including senior most pediatrician in Bangalore, Dr. Rajat Atreya, along with Dr. Shweta, Dr. Neha, Dr. Manju, along with me. So, going forward, there are certain conditions which specifically flare up during certain seasons. Say, during monsoons, we see so many respiratory diseases, so many diarrheas, so many viral infections happening. As well in summers, we see so much of heat stroke, dehydrations, typhoid, and few allergies also flare up in during summers. Today, let's just to give you context, why do such things happen? I mean, they are there always, right? Bacteria and viruses are present everywhere. But like, why do they, flare up during particular seasons? So these bacteria and viruses need certain specific humidity, certain specific temperature, certain specific, soil type, certain specific, water to grow well, right? So probably that season provides the best breeding ground, so that they can grow and breed and infect the people around. So coming to summers in India, we do not specifically have spring as such. I mean, it's included in the summers. Most springs in India are between March and April. So the most of the March and April months across India are summers. So most common conditions which flare up during summers are allergies. Okay, so a few allergies, uh, uh, like hay fever. We call it something called hay fever. What is it? So the plants products like pollens and dried leaves, which are mostly present during summer, can be flown through the air, and the people who are allergic to such allergens can present with allergic conditions. They can present with certain symptoms like runny nose, itchy nose, fevers, even that's why it's called hay fever. I mean, hay is a term for dried grass. So the condition was identified as such. They can present with the children who are allergic and asthmatic, or can present with asthmatic attacks. They can come with difficult to breathe. They can come with almost, we have seen children coming with impending respiratory failures. So what can be done during these conditions will prevention part will come to later. We'll just understand what are the common conditions that can be present in summers. So skin infections are common during summers, because extensive, I mean, bad heat can cause so much of dryness of skin, and it becomes easier for certain uh, basal tendency to cause allergies like atopic dermatitis, which can be there in the children, but because the condition of summer has come up, and there's a good ground for it to flare up, such thing can happen. And I am not able to move it. Just a minute. Okay, so few respiratory infections are common during summer seasons. The same, the children who are basically allergic are the ones who come with respiratory difficulties. So a few viruses are common during summers, like rhinovirus, something like adenovirus. All these common viruses, which might not cause so much of problems throughout the year, can come with certain problems during summers. We all have heard this disease called hand, foot, mouth disease. In last few years, we have seen so many children with hand, foot, mouth. They are common viruses. They are present since very long time, but they flare up in certain climate and certain time period. The hand foot mouth disease is a condition which is caused by something called Coxsackie virus, which causes rashes on the body, specifically involving foot and hand and mucosa of the mouth. So there most of the viral as most of the viral infections are self-limiting. We have the treatment would be supportive treatment. So they usually do not cause any much of problems, if not they complicate into certain conditions. So one of the condition which we are all worried in summers are dehydration. In the north part of the country is extremely hot during summers, like around Delhi, around Jaipur, around Rajasthan, Uttar Pradesh are extremely hot during summers, crossing more than 45. Even we saw this year in Bangalore crossing 40s, which have never come across in Bangalore. So in such conditions, conditions like heat stroke causing dehydration has been a very important condition this time. And certain conditions like enteric fever, typhoids. Enteric fever is a term, medical term for typhoid, which you all, as we know, are more common during summers. It's a waterborne disease. So all these are few common conditions which can happen in summers and springs. But just I did not want to concentrate more on summers because we are already entering monsoon now, right? How do such seasonal changes changes situation for us? So there will be sudden change in temperature and humidity. So so many infrastructural deficits like potholes, construction sites can be can become sudden breeding grounds for so much of vectors like mosquitoes. It becomes a situation where it becomes a good breeding ground for mosquitoes to grow and cause infections like dengue, malaria, chikungunyas, all those infections which are transmitted by viruses, by mosquitoes. So the one of the most common original gangster of diseases which used to be transmitted by mosquitoes is malaria. So although we see the malarias have gone down a bit in recent years, but it's definitely a disease to be careful of, watchful of. So this is caused by a female Anopheles mosquito which carries a parasite called Plasmodium. What are the symptoms of malaria? Malaria, the symptoms will be extreme. The like any viral or bacterial infection, the fever is the most common cause. Presentation of malaria that can present with chills because of very high grade fever. They usually present in cyclical time periods. Like few of the viruses cause once a day fever. Some of the parasites cause 6th hourly, 12th hourly, different kind time periods will be there. So the depending upon the which parasite that mosquito is carrying, the duration of fever might change. So what can others be the symptoms of malaria? The severe headache, severe tummy pain. They come with high grade fever spikes, with the vomiting, with the abdominal pain. All these things are common symptoms of malaria. So, as the coordinator was explaining, though the common condition these days are the disease is going on these days is dengue. Dengue is again a virus which is carried by mosquito called group of mosquitoes called Aedes mosquitoes. So especially I want to talk more about dengue because every third child which I'm seeing in the outpatient department coming with fever is a case of dengue. So the symptoms can be a bit dramatic. The child will be all right a day and he'll come back from school the one day and starts to have high grade fever spikes. So what are the signs of dengue and when should you come to doctors is a very important point to be noted. So dengue is most of the children who are affected by dengue can will be okay and recover in few like 3 to 5 days. Like 90% of them do not have any complications. They'll recover as any other flu kind of infection, with supportive management, with paracetamol, with hydration management. They'll get better. But there are few percentage of children who come up with such severe symptoms. Dengue can cause significant problems like brain pathologies, cardiac issues, liver issues, the dysregulation of immune system. So much of complicated complications can occur because of dengue. But that's a small percentage of children which come up with such complications. So initial for first to first 0 day to 3 to 4 days, there will be high grade fever spikes, and children will be weak, not active. They might come up with vomiting. They might come up with reduced urine output. These are the points which are we are interested in, whether the child is active or not, whether the child is having headache, whether the child is having vomiting, whether the child is passing good amount of urine or not. All these are common symptoms which you look for to find out whether this dengue is just a type where I can treat at home, or we have to be more careful, and some might need admission in the hospital to monitor the symptoms. So especially I'm going to tell you, because all this session targets parents, which I want to tell you, please do not allow your children to play in parks without full sleeve clothes, full length pants. You might consider applying mosquito repellents like when you send them to play out. And it's a good idea to close the doors, windows after evening time, right? And it's a good idea to use mosquito nets during like while sleeping. So although the malaria, yeah, as I described earlier, is a condition which is carried by mosquitoes, especially during night times. But dengue fever is interestingly, it's carried by mosquitoes which are who are active in the morning time. So it's very important for for you to use full arm sleeve clothes and full length shorts while going to school, while going to parks in the afternoon or evening times. So you can ask your schools to make sure to make sure there are no mosquito breeding areas inside the school. There are no puddles of long standing water, or they are like they are checking the source of water in the school. That can be bit helpful. uh, so what are the symptoms which come with warning signs? Dengue, which coming with severe headache, is is very concerning. Dengue which come with very high grade fever spike. The temperature of a child between 99 degrees to 100 degrees is okay, mild temperature. If any child has temperature of more than 101.5 degree Fahrenheit, is called high grade temperatures. So anyone who is having high grade fevers is a warning sign. They can have severe body aches, like joint pains, like body pains. Wherever you touch, there will be tender. That can be a warning sign. So in dengue specifically, we all know that platelets, which are particles in the blood which help in coagulation, it's clotting of blood, it's a function of platelets, they go down, right? So they can, come up with something called petechiae, which are shown here. They can be, bleeding spots of skin due to, reduced platelet count can be a warning sign. And redness of eyes, burning sensation of eyes, vomiting, and bleeding, all these are the warning signs of dengue. So in dengue, as I told you, only, 5% of children do get admitted in the hospital for hydration. Fever is a, such a condition which increases children's body metabolic rate also. So fever itself is a cause of dehydration as such. So dengue is a special, disease where the water content in the blood can, decrease because of leaking into body spaces, in turn causing dehydration. It becomes a, double-edged sword where it becomes a vicious cycle. Fever causes dehydration, and dengue also causes dehydration. The children will become extremely weak, and they're present with significant complaints of, tissue perfusion being reduced. Like for example, like urine output being reduced because of kidneys are, dehydrated. Such symptoms are, very concerning, for the family and the doctors. So next important thing which I would, consider is typhoid. Typhoid is a, disease caused by bacteria called salmonella, which, the bacteria needs high, common during summers, spring seasons. It's a waterborne disease where, the bacteria thrives well in the hot temperature. So the common symptoms are of the typhoid are abdominal pain, severe, fever, which is not responding to conventional therapy. They can present with vomiting, diarrhea. They can also present with severe headaches. The symptoms are, the common symptoms between any of the infections. So high grade fever spike, headaches, rashes, all symptoms of typhoid. So recently we had a, in outbreak of something called cholera in Bangalore. In previous times, cholera used to be a deadly disease during 1900s. I mean, like initial part of the 20th century, where, cholera used to, killed millions of people. Such a deadly disease. But along the way, we found out, drug which is, which is very effective against cholera. We did not see cholera with for so many days, and all of a sudden when there was a severe short supply of water in Bangalore, which might have in turn caused water sources to be contaminated, flared up cholera to present to our conditions, to our hospitals. So cholera is such a, condition where it can be very devastating for smaller kids, because it causes severe amount of loose stools, watery loose stools. If any child loses more than 10 ml per kg of body fluid, can, present with moderate to severe dehydration to the hospitals. So this is like these are symptoms of, cholera, vomiting. They come with diarrhea. They come with, loss of skin elasticity, which is an indication of dehydration. They are the children who are not yet sick, but they are going towards, severe form of it, might have increased thirst. Moderate dehydration can present with, the children preferring to drink more. That's not a, good indication. That's actually children. Children do not usually take orally well, like when they're sick. If they are sick and they're not they are eager to drink water, it means that body is, trying to compensate and asking for more of, water to fight dehydration. And also because of so much of dehydration, they might present in, rapid weight loss, which is very, devastating for patients. One of the common conditions used to be hepatitis A, although it is reduced in, in recent years because of good, probably improved living lifestyle, improved hand washing practices maybe. So, but it's still conditions to watch for. Is hepatitis A is a virus which affects liver, causes, severe abdominal pain, jaundice, liver dysfunction, diarrheas are the or the presenting features of hepatitis A. So one of the common causes of respiratory infections in our kids is influenza. Influenza is a virus which has multi has a varied antigen presentation capacity, which changes its like antigen capacity, so that each year it comes with different kinds of combination of influenza viruses. So that's why we have recently started to tell, not recently, at least last decade, we have started informing parents and educating them that influenza vaccine is extremely important to give before monsoons. We'll talk about it later a bit, how to find, differentiate between common cold, which might not be so concerning, which also caused by viruses, which probably are not so virulent. Yeah, flu caused by influenza vaccine, influenza virus can be a deadly condition where children present with high grade fever spikes. Again, they're coming with the, not taking orally well, abdominal pain, severe headaches. All these are symptoms of flu, symptoms of any viral infection. In addition to that, influenza can cause pneumonias, infection of lungs. It can cause infection of brain, encephalopathies. They can present with sepsis, I mean the generalized body infection. All these are severe manifestations of influenza. So common cold is a we see all through the year. Some viruses like rhinovirus, or human metapneumovirus. All these are generally cause flu or common cold, depending upon the host. The presentation will be slightly different. So anyone who is coming with the high grade fever, fever spikes, with body pains, extreme fatigue, these can be push the diagnosis towards flu. And all these conditions can be present in flu as well, like cough, runny nose, stuffy nose, sore throat, headache. They can present in both of the conditions, common cold and influenza. But the although there is a overlap, we can identify flu by extreme body pains, extreme fatigue, not taking orally well, all these symptoms. So chikungunya is one of the conditions. When we were starting medical practice, probably in 15 years back, there was a huge outbreak of chikungunya where so many adults had severe joint pains, joint swellings. They had significant fever spikes. We did not know what medication to use at that point. Although the treatment is symptomatic, is also caused by Aedes mosquitoes, which like same like dengue. So the symptoms are like any viral infection: high grade fever spikes, generalized body aches, and rash. So it can it spreads through unhygienic practices, like using drinking from untreated water source, unhygienic sanitation, not washing hands well. All these are the causes. Coming to prevention, prevention is the is the only way forward. By we expect dengue to rise in the month of June, July. So by April, I start telling parents, dengue is coming up, please like start practicing prevention strategies. Just as I told you, please, and do not keep the windows and doors open after certain time. Using full clothes, full sleeves clothes, full length shorts, using mosquito repellents, washing your hands more frequently. All these are strategies where you can prevent certain all these conditions. So elimination of mosquito breeding sites is a large initiative which has to be taken by everyone, as individually, as a society, as a probably in the local governments. All like when all the entities come together, we can do a better job in controlling mosquito breeding sites. So as you all are from apartment, you can push your RWAs and societies to to have certain strategies, and do not allow small puddles where the water is filled for long time, and across your compound, there's the possibility there is a unused sites which can become sites of mosquito breeding. And you can individually follow all these practices of using mosquito nets, you putting the mosquito measures to your windows, you using full length dresses. All things can be practiced as a community so that we can bring down the burden of disease. Personal protection measure, as I just was telling you, to use all the full length dresses, mosquito nets. Probably you can use few instruments to kill them if you find them. So all these are measures to protect yourself. Now, safe water practices. I am sure all of you are doing it already. In recent years, I find you have certain companies doing check of quality of water in our houses. So that has improved a bit, but you can also make sure we do practice safe practices in probably in a limited resource setting where we cannot afford everything. Probably long handle cups which can prevent contamination of clean water can be a thing, and boiling water before drinking can be a good practice. Washing hands is certainly a good a good habit, and using water filters, clean packed waters. All these are good safe water practices. And hygiene practices, I cannot overstress the importance of hand hygiene. Hand hygiene is single most common strategy you have to take away from this probably the session is hand hygiene. Hand hygiene prevents most of the contamination of the surfaces, interpersonal spreads and everything. Probably I'm assuming like, and also I see the general education about hand practice has significantly improved post COVID, when we all were educated by government societies, doctors, and healthcare professionals, that through hand hygiene we can prevent all these infections. You can I'm sure the schools nowadays are teaching these practices to our kids. Probably you can put an extra effort to teach hand hygiene measures. Hand washing has 6 steps of using of doing it. So rubbing your palm, rubbing your back of your hands, cleaning of the thumbs and the wrist, and the fingertips. All these are 6 steps. If you can easily find, I would I would like to have a picture of that. So hand hygiene is extremely important. I cannot overstress the importance of hand hygiene. And next is cuff etiquette. So we any children, our children are superheroes. You teach them anything, after certain appropriate age they will learn it. So if you teach a child who is probably 2 years and above to use cuff etiquette measures, they will definitely learn it. So what are cuff etiquette measures? Cuff like whenever they're coughing, whenever they're sneezing, they can use handkerchiefs, tissue papers, or they can cover their mouths and noses using a belt bent elbow to cover the part, so that it doesn't spread easily. Is all these are all common and very important practices to prevent infections. So, and after you cough or sneeze using handkerchiefs or tissue papers or bent elbow, you have to you sanitize your hands either by hand rubs, sanitizers, or wash your hands for at least for 2 minutes. So consuming safe food and clean food is very important. Although we all love to go out and eat certain sometimes in a month or so. So it's important to note whether the food is made fresh in the restaurant or not. Try to avoid eating on the street using, I don't know what are they use in making pani puri or puchkas these days. So we all find so many kids coming with stomach upsets because of these unsafe practices. So but it's always advisable to use home cooked food. No, do not easily more frequently visit street vendors if they're not safe. So and early treatment, early coming to center, healthcare center is very important. What I see in certain some parents are, no, Dr. Saab, the syrup was given to my child when he had cough and cold a month ago. I'm giving the same medication now, and I'm waiting at at home that will get, hoping that will get better for 3 days, and coming back with severe form of infection. That's quite disappointing. So few parents do give paracetamol medication when they are like when they have a fever, which is good. But children are growing, so dose of paracetamol in children can vary significantly if it is not been given recently. So say the child was around 10 kgs at 12 months, and he's say like 1.5 years now. If his weight has increased to 13 or 14, the dose of the paracetamol significantly changes. So you keep on giving small dose of paracetamol for the small weight, and the fever doesn't get better. So early visits is important, and previously do not use previously prescribed paracetamol or any medications should not be used without prescription. And also I see so many parents coming up with using nebulizations at home. I mean, it's very disappointing that to seeing parents use nebula. Okay, if you're giving once and coming back to a healthcare center, that's okay as a first aid. But it's definitely not advised to keep on giving nebulations in hope that they'll get better. Nebulations, the medication which you put in nebulizer has a specific indication for each presentation. So please do not use previously prescribed nebulations if your child is not a known case of asthma and they're already prescribed specifically for asthma. And apart from timely treatment, early visits, not using previously prescribed medications, cough etiquette, hand hygiene. The most important thing is balanced diet. I cannot overstress importance of diet. Although we know it's difficult to feed our children, if they are, I mean, they are fussy, they don't eat well. The only option we have is try and make an effort to improve their eating good eating habits. Probably you can talk to your doctor how to improve his eating practices. So in a balanced diet with a good amount of calories, good amount of protein, lipids, essential lipids is extremely important to prevent these infections. Lot more kids who are not nutritionally well are the ones who come with severe problems than the ones who are well. So the take home message for today's event will be personal and environmental hygiene. Push yourself to do a certain personal care, as I told you before. Push your societies to come up with initiatives to engage communities to bring up good practices at your own societies. Consume safe food and water, and please seek the medical attention at the earliest. So this is the crux of my talk today. Prevention is better than cure. So early identification, early visit, and early treatment can make a lot of difference. Thank you.
That was wonderful. That was wonderful presentation, sir. I'm pretty sure all of
Thank you.
us followed that and got a lot of knowledge. Meanwhile, I am got lot of messages myself that many people were trying to join, but because of Saturday they went out. And the common request is that we record this session so that people can view it offline. So we are recording it.
Sure.
I hope this video will reach to maximum people, even if they are not able to join here. But thank you very much, sir, on those things. Now I'll ask Madhumithra to come up with the Q&A session. There were some questions asked to me, which Madhumithra will do. And if anybody has any questions, please either raise your hand or type in the chat bot, and then doctor will answer you. Ashwini, over to you.
Yeah, thank you, Pandaji. Here, like, there are two types of forum open. Like, one can unmute and ask the questions to Madhumita sir, or like even the chat can also be type chat question can also be taken. Here, sir, I do have one question. I'm middle-aged person, but I do have a symptom of allergy and I do have asthma where I'm previously taking the medication. So, is there any special preventive measure should be taken from my side?
Okay, so the patient is a known case of asthma and is on treatment, you're saying, right?
Yes, yes,
Right now he's on treatment already.
yes.
Okay, so these are the people who are at risk for more of respiratory infections. The children or the no, people who have allergies and asthma are the ones who are at risk for respiratory infections. So the care is probably they end up in more severe condition than the other for the same disease. That's a point here. And the treatment wise, the please keep continuing the medications prescribed by doctor before. Do not stop them. And probably for for if you find today night you have increased cough and cold, you are an asthmatic, non-asthmatic, and you're feeling bit difficulty to manage, probably you can take one or two puffs extra than you were taking, and you have to go to the doctor if you don't feel in next 1 to 2 hours. Okay, so do not ignore that. Okay, this is known problem to me, and let us not go to the doctor. That's a bad practice. So probably you can try taking one or two extra doses, and see if that's helping you. If doesn't help, probably the wise choice is to go to doctor and get them examined. And also children who are known cases of asthma and allergy, we always tell the parents to vaccinate them impeccably. They have to be vaccinated for certain condition, diseases like influenza vaccine. Influenza vaccine is a vaccine to be given twice in a year, less than 1 year of age group, at 6 months and 7 months. After 1 year of age group till 8 year, you have to give once a year in the month of May. Okay, why May? Because that's the time when we're expecting monsoons in most part of the country. So by end of May, probably between May and June, you might have to consider giving influenza vaccine to our kids till at least 8 year of age, especially for less than 5 of 8 children. And the children who have all allergies, the ones who get fall sick frequently during winter seasons, the ones who have like hyperreactive airway conditions, with asthma, all these have to be get vaccinated till 8 years of age. And good nutrition, as I told you, and all these hand hygiene practices, all these are good practices to follow.
Thank you, sir. Thank you. And I do have one more question. Does dengue always require hospitalization, or is there any way can I take medication or any thing at home?
Okay, so definitely not. Dengue, as I told you, 99 to 95% of the children who come diagnosed as dengue are like any viral infection can recover in 3 to 5 days without any complications. But the most important thing in dengue is keep watching for warning signs. The warning signs in dengue are, as I told you, abdominal, stomach pain, severe headache, high grade fever spikes more than 1 or 2 degree Fahrenheit, kind of fevers, vomiting, no, not by passing urine at all, not able to take anything orally. All these are warning signs. So if anyone with do not have these signs, only with some fever which are manageable at home with medication, then they are okay. But if anyone with warning signs are the ones who needs bit of monitoring and hospitalization. And I see I get asked by so many parents, can we can we give papaya leaves, I mean powder papaya, I don't know, the kiwi fruit, dragon fruit. I'm really not a person, to say yes or no. Because I'm not a Ayurvedic doctor. I don't know really. I've not researched myself to find out efficacy of them. But papaya extracts have in some studies have shown increasing, but we have to weigh the risk against benefits. Please do not take those medications without prescription. We do not prescribe in children such medications at all, at any cost. Fruits are okay, you can eat. If the child is liking to eat all those fruits, no problem. But all these tablets which come with such extracts do not have any evidence as far as pediatrics is concerned, as far as children is concerned. And also they have a bit of they might cause some problems in liver. Dengue also cause some problem in liver. It becomes a difficult condition to treat if you're taking unprescribed medications.
Thank you, sir. Thank you. And I have received one more question asking at what age for the children we can give like vaccination, especially for influenza?
Okay, so the first vaccination will be at 6 months, and next vaccination will be at seventh month. Okay, this is the first year. First year, I have to take two vaccines. Two times. The schedule is at 6 month and seventh month. After 1 year, the schedule is one dose per year. Definitely till 5 years. You can give till 8 years for the children who are at risk, and give it in the month of May and June before the monsoon start. Pre-monsoon is the best time to give vaccine.
Yeah, thank you, sir. And I have received one more question. So there are, if any sudden allergic attack like asthma or food allergy, for example, if some people will be having, if they eat even peanuts also, they get the allergy. Is there any special things like precaution measure when we go out, like we have to carry, or if any medication where we can take, like even when we are traveling or when we are in the vacation?
Okay. Okay. So these some children, some people are allergic to certain things. You took an example of peanut allergy. Although Indians are there are cases, but the compared to Western countries, the peanut allergy is slightly lower in our in our country. The people, the ones who are diagnosed with peanut allergy or any nut allergies, they can carry something called EpiPen. Okay, so in Western countries, more so many of them have such allergies. They are advised to carry something called EpiPen, which is a adrenal injection. Okay, so any sudden, as you said, sudden onset of allergy causing swelling of lips, swelling of eyes, can actually cause swelling of airways and make them difficult to breathe and have dire complications. So in such people, probably it is best to talk to your doctor and carry such injections which you can administer yourself, so that you'll be safe.
Yeah, thank you, sir. And I have received one more question asking that can I give a good supplement like multivitamin syrup or a Revital tablet to increase the immunity among infant or even school-going children?
Okay. Okay. As I told you, balanced diet is the most important point of all the practices. Balance eating good nutrition, balanced diet, good amount of proteins, good amount of essential lipids, good lipids. Eating good amount of calories prescribed for that age and weight, This is what is important to build up immunity. Okay, so and if you follow good nutrition, you will anyways, like end up having good micronutrient source as well. Okay, so yes, the ones who have these micronutrient deficiencies, the one who is not eating well, probably multivitamin syrups will help in covering up those deficiencies, in turn helping in nutrition, and then probably they are better prepared to fight infections.
Thank you, sir. And the last question is like, what are the measures to be taken at home, especially for the children who have the waterborne disease like stomach pain, diarrhea, etc. They're asking like any home remedy which will work at home, or do we really want to take the kid to the hospital? How do we do?
The for prevention, right? Prevention of
Yes,
waterborne diseases. Okay,
yes.
although we the waterborne diseases are slightly better in, it depends upon the what socioeconomic classes you are in. If we are probably the people who are the for us the people who stay in apartments, and probably we are well off, so we are already using good water practices, good water source filters, frequent checkup of filters, they are working properly or not, what is the pH, what is the the check TDM checking, what they people do. All these safe practices are one thing. These waterborne diseases are more common in lower socioeconomic classes, where they couldn't cannot afford quality safe water. And apart from having safe water, the one more most important point here is hand hygiene. So we have to practice, it has to be inculcated into our practices and habits of daily habits, that everyone has to wash before eating, after eating, before using public restrooms or private customers home. Wash hands with soap after using restrooms, and before using restrooms, and before keep sanitizer if you're going out. All these are good practices. Probably if you're sending your child, ask him not to drink water from unknown sources. It's better to carry a good, safe water from along with them. And probably it's better, and it's a good option to carry sanitizers along with them, to clean the hands before eating, and after using the restrooms. So safe water, probably if you do not use filters, then boiling water and cooling them, and then drinking them can be a good option. And do not allow inside the home itself. Do not create allow places where there can be a water collection. Probably in our utility areas where the sites are not accessible, if you are dumped everything in your utility area, probably that can become bit of a place for mosquito breeding. uh, ask your societies to come up with strategies to come up with safe environment.
Thank you.
Thank
Thank you,
you,
sir,
sir.
for your valuable answers to the question, and thank you, Ashwini, for coordinating the Q&A session. On behalf of Bangalore Apartment Federation, I extend my sincere thanks to all of you who have joined. I know it's a weekend, and we were expecting more than 70. Most of them have unfortunately gone out. I'm pretty sure we will have better attendance going forward. But the recording which we will have more and more viewers anyway. Again, all of you stay tuned for more session, because we are going to have special focus on the women health going forward, and that's where we want all of you to get value out of it. And of course, our gratitude goes to Dr. Madhumithra for gracing this occasion with your knowledgeable session and for sharing your valuable insights with us. I'm pretty sure we will again reconvene with such more and more session, and we will ensure that we, as a BAF and Rainbow Children Hospital, together create that social impact what we are intending to do. And Pankaj, thank you very much for helping setting up this session, and special thanks to Rainbow Children Hospital. with whom we are collaborating for such knowledge session. Thank you, all of you. Thank you, Dr. Madhu. Have a nice weekend. Thank you very
Aditya,
much.
thank you. Thank you so much. Thank you, everyone. Thank you, sir. Thank you,
Thank you.
doctor.
Thank you.